Well, my name is Beth Mans, and I was diagnosed with breast cancer back in June of 2018. My grandmother on my mother's side died of cancer when she was about 52 years old. That's right about where I am right now. I chose to have a bilateral mastectomy. The cancer was only in one breast, but I felt like I didn't want to take a chance. I was being very, very, cautious. So my surgery date was August 8th, and that happened to be the day that my grandfather passed away. And it was so funny when I went into surgery, my aunt said to me, "Now, Beth, Grandpa Rawlings going to be watching you when you have your surgery." And I said, "As long as he does not beckon me towards the light, I'm fine, but please do not let me come to the light." So anyways, everything turned out fine. And when I reflected back on it, I had a really great positive attitude. I really didn't let cancer get me down. And then I came across a journal entry of mine somewhere around right around Thanksgiving, and almost midway of my whole treatment. And I had gone to see my oncologist, and actually the nurse made a comment to me, and she said, "This is about the time that you get to be sad." And I was sad. I could tell from my journal entries. I was just, having trouble sleeping and just, scared, okay, when you first get the diagnosis, you're like, fight. That's all I'm going to think about. I'm going to be strong. I'm going to do it, kick this thing, rah, rah, rah. And then you proceed through, and then all of a sudden chemo starts to get you, and you're like, oh my gosh. And my skin was peeling off, and it was from the red devil. So my hands were splitting, and they were swelled, and my fingernails turned brown, and they almost looked like they were going to fall off. At that time, you're just like, oh my gosh, it's going to get me. I just know it. And you begin to be fearful, because then you're like, okay, well, I'm getting close to the end. I'm almost there. Will I make it? Or are they going to come back and tell me that, it didn't all work? And that's the middle. But then towards the end, there's the next fear factor, because you go in and you're like, yes, I made it. I got through chemo. I managed to survive that. Radiation wasn't that rough. I was good. And then they say, well, here's this little pill, and this is all you're going to take. And for my doctor, and I understood her logic, they don't do scans, So like you're ready to go in and say, okay, put me in the CT scan and scan my body and find those nasty bugs and make sure they're not sitting somewhere else and that we need to do something more. And they say, no, you're done. We expect great things from you. And you just need to wait and listen to your body. And you're like, what? Wait a minute. I want a scan. I want somebody to tell me I'm okay and that there's nothing there. I feel fine. I feel strong. I feel good. But maybe there really is something there, and it still makes you fearful. So, I'd like that scan, I really would, but I'm not going to get it unless there's something, that I see. And so for right now, I'm taking the knowledge that I'm listening to my body every single day, that, I do a little head-to-toe check when I wake up in the morning, and I say, okay, am I coughing? No. Do I have deep muscle pain? No. Do I have any other things that are different? And, they've told me, 2 weeks. If it's not persistent for 2 weeks, then, you're good. If it persists longer than 2 weeks, then call us, and then we'll talk. As I see it right now, I'm in great shape. I run every morning. I feel good. Is there a niggle in my brain every day that maybe it's going to come back? Sure. Yeah, definitely. But at this point, I think I'm good, and I think I'm strong, and I hope I don't have to fight it again. But if I do, I'm ready for battle.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Welcome back to The Cancering Show. I am so excited to have my friend and colleague, Dr. Ron Franks, our professor and chair of the Department of Psychiatry at the University of South Alabama, here in the studio today. You've just heard Beth's story, and we talk a lot about the mental aspects of a cancer fight. And so we wanted to bring Dr. Franks in to talk more about the fear and anxiety that can go with a cancer diagnosis and what tactics you can use to help get through that part. Welcome, Dr. Franks.
Thank you.
Thanks for being here. Let's talk about even before Beth's story. I see patients who have been fearful of coming to the doctor before the diagnosis, maybe even feared getting that mammogram or pap smear because they suspected something was wrong, or just every time they don't want to come because of the possibility they might be diagnosed with cancer.
Well, it's a very common reaction, and I'm sure you see this with patients that need to have a screening test, such as a mammogram, and because of either fears that relate back to family members or friends that have gone in thinking, oh, everything will be all right, and all of a sudden have a diagnosis, or just generally an outlook on life that good things don't happen to me. So I just as soon not have a mammogram because I know it's going to turn out bad.
How do you help patients who know they need to go for a test or a doctor's visit or something else that's looming in their life and trying to get up the courage to go?
Often, if they're given an opportunity to talk about what they fear will happen and the reassurance that can come with factual information, and particularly about the positive outcome if it is cancer and the types of new treatments that are developed, as well as the odds of it being normal, can help them overcome their fears. And occasionally, a little medication can help them as they get ready for the test to take some of the edge off of their anxiety.
Well, I appreciate that. I do a lot of work in cancer prevention, and this is what we're trying to do, right? Get more patients in for those cancer screenings on time. But let's move into Beth's story. She talks about that shock of the diagnosis and thinking back to her grandmother who passed away from cancer and that fear that she might even pass away from the surgery.
Yes, that's a very common experience. Once you've been told you have cancer, all of the worst things go through your mind usually first. And what we saw with Beth was that she had to process some of these memories of her grandmother. And then, having been able to do that, she said, you know what? The best way to deal with this is to fight. Now, some patients feel overwhelmed by it and don't believe they have the courage to fight, and they can become depressed in the face of this and may even avoid the treatment that they need because they have already resigned themselves that this is going to take my life. That's when an intervention with their oncologist to help them talk about what they're afraid of, what their past experiences are. And in some cases, they might need an antidepressant to help them cool off the intensity of these fears so that they can go ahead with treatment and develop a sense of optimism, especially when the facts would support that.
And with our patients, we also talk a lot about the other things, surrounding yourself with the team, your family and friends who will help you fight, whether or not it is a primary care physician or even a psychologist or psychiatrist to help you through these times of fear or anxiety. The other stuff we talk about, are you sleeping okay? Are you exercising? What sort of things have worked for you in the past? What do you tell patients to do in that time frame when they're trying to help get back to some normalcy in the midst of treatment?
Well, the most important thing is to help them feel a sense of control as opposed to being controlled by the cancer. And so to restore the normalcy of their life as you talk about it. And one of those, most importantly, is exercise. At least 20 minutes a day of walking or even more vigorous exercise will release the internal endogenous antidepressants. And so they help us get to a point where we're not feeling as overwhelmed by anxiety or depression, if that's present. Restoring if they have been off of a good diet, getting back to a good diet, making sure that they don't stay isolated in their home, but continue to meet with friends and family and receive some encouragement from them. All of that helps them then realize, you know what, I'm going to take control of this, as we saw with Beth. And whether they use fight or control, but they don't feel like a passive victim.
Right. I think that's so important. Now, Beth talks some about that mid-treatment fear, as she calls it, the sadness. And I do see that a lot with patients, whether a lot of times as doctors, maybe we describe it as fatigue because patients are staying home a lot or staying in the bed a lot. But also there's some chemical changes in your brain. We're giving you chemotherapy, we're giving you steroids. We actually might alter, as you said, some of those endogenous hormones that can help create hope and optimism. Do you see patients in that phase?
Yes, and I think the fatigue comes from as much the psychological as the physical. Chemotherapy, radiation, they take a toll on you. They sap your energy, and it makes it harder to feel optimistic if you're not feeling well. And so that often takes more encouragement from the doctor, from the family, and continuing those activities as much as possible during that period. Now, we also know that with the chemotherapy, not only does it deal directly with the cancer, it also affects other organs of the body and can have some impact on cognitive functioning as well. So if the patient's not sleeping well, trying to help the patient get sleep can restore their sense of being in control and having enough energy to deal with the daily activities. Making sure that they get enough energy from their food, combating nausea with whatever works, including medication, are the kinds of things that can help them feel the optimism that they hopefully have when they started their treatment.
I like what you were saying about kind of controlling the symptoms and how that plays into the patient's overall outlook on how things are going. I think as physicians, sometimes we feel a little bit powerless in the face of depression or anxiety, or even recurrent depression or anxiety that seems to be getting worse. And we think of that as a separate diagnosis when really it goes hand in hand, maybe with uncontrolled pain or uncontrolled nausea or poor sleep. There are really things that as a physician, we can feel a better sense of control in the ability to help with those symptoms that can make patients feel better overall.
Exactly. If you think back to the worst case of flu that you've had, and when you think, oh, I can't even get out of bed, and you get out of bed and you say, all I want to do is get back in bed, it can feel a lot like depression at that time, but actually it's a physical response to the flu and your body mustering the energy to fight the flu, and it puts all its efforts into fighting the flu. There isn't much left over to get up out of bed and feel like doing anything. And that can be the way that chemotherapy can affect the patient. And so sometimes It's hard to distinguish. Is the patient depressed, or is the patient having a physiologic reaction to the treatment?
Yes, absolutely. And staying on top of both of those things is so important. One of the things Beth mentions that helped her during her treatment was journaling. Do you recommend that to patients?
Definitely do. In fact, what I tell patients, if they're in any kind of supportive therapy or working with a group cancer mount, et cetera, the journaling in between those meetings is like an additional session. And I find it being much more effective than if they just think about what happened in those sessions. When you have to commit yourself to writing, then your thoughts get better organized and they have a greater impact. And if they go back later and reread that, especially if they're having a good day, it can neutralize some of the distress and discouragement they may feel on a bad day and realize, actually, I wrote that, didn't I? And so they can use that to help mitigate or reduce the intensity of the fatigue or discouragement, as I said, during the bad days.
That's really interesting. I've never thought about that reflexive nature of your own writings, but more kind of the exiting strategy, that the emotions are exiting onto the paper. But I never really thought about the reflexive nature of that you can look back and say, hey, that was a good day, and there are going to be good days and bad days, and this too shall pass. That's really interesting. So Beth talks about cancer might get her. I've used the phrase with patients feeling like you're being chased by a tiger, that you finished your treatment. There is a wide open plain of you going on to the rest of your life, but it feels like there's always something maybe behind you. And is there a ticking clock? What do you tell patients at that phase of cancer treatment or end of treatment?
Well, maybe not quite being chased by the tiger, but every time they look around, they notice that the tiger is sitting there, and they don't know if the tiger is going to come after them or if the tiger is going to just stay there and maybe at most be a nuisance because they haven't gone away. And so for many of my patients, that is the way that they approach it. And if they focus a little too much on the tiger, then try to give them factual information about where things stand and the likelihood of a positive outcome, et cetera. And then give them an opportunity to talk about the fear that all of a sudden the tiger might get up and start chasing them. And that the best way to deal with the tiger that's chasing them is to say, all right, I'm not going to be intimidated by you. If there's something going on, I better get in there and get my test, because the best way to deal with cancer is early, not late. And so we don't want denial getting in the way of good treatment.
Absolutely. The other thing I've heard this post-treatment fear related to is post-traumatic stress disorder. that getting a cancer diagnosis can be no different than any other type of event where your life was seriously threatened. How does that help patients to better understand why they have anxiety or to treat it?
Well, PTSD is a common phenomenon with being given the diagnosis of cancer. And it would be similar, let's say, to an auto accident or another physical injury. What you see with PTSD are often nightmares. They can wake the patient in fear, and as they try to gather themselves and realize, okay, I'm overreacting to it, et cetera, et cetera. There also can be flashbacks that can occur when all of a sudden they feel like they're back in the doctor's office being told that they have cancer. Usually these are more likely to happen if they've had a significant psychological trauma in the past, or that they have witnessed it in someone who is close to them and they've seen what that person has gone through. Usually under those circumstances, if the patient finds that they are getting paralyzed by it, a referral to a psychiatrist can be helpful. Or instead of that, maybe a trial of medications first, such as SSRI antidepressants. Occasionally what we call benzodiazepine, a mild tranquilizer to help reduce some of the intensity of the anxiety. The advantage of PTSD is it's the mind's way of healing.
Interesting. Never thought about it that way.
It's similar to when you have a cut or a sore. What happens is that you experience pain. Pain becomes the way of triggering the inflammatory response so that the white cells and all the other antibodies come in to heal that wound. Well, the psychological pain that comes with a trauma is the way to signal to the brain, listen, we got to get to work. We got to get ourselves back to our normal state. And it's going to be somewhat painful as we do that. But that pain is signaling to the brain and to the mind, let's get to work. Let's get this under control. And in most cases, that's exactly what happens.
That is fascinating. I never really thought about it that way. When you think about that, what are the sort of triggers for patients to look for and the tactics to heal?
Well, certainly if depression sets in and it's more than just a response to the chemotherapy, what patients begin to report is that they feel hopeless, helpless, worthless, may even have thoughts of taking their own life rather than become a victim of cancer and never know when that might happen, even though they may have a good prognosis. Those are warning signs that the oncologist or referral to a psychiatrist needs to help the patient, often with a combination of medication and therapy to lessen those feelings and have a chance to talk through their fears and anxieties about cancer and what it means to them.
Absolutely. And do you find some of the same things we talked about earlier help in a PTSD or major depression, one of those real psychiatric diagnoses?
To be sure, and patients usually have a very positive response to both medication to reduce the intensity of the feelings. It's like giving an antibiotic when you have an infection. It helps reduce the intensity of the infection so that the body's own healing forces can come in and take care of that infection. And in the same way that we're talking about therapy or supportive relationships and journaling, that can help you process it and restore yourself to a sense of optimism and control. As we heard with Beth, she's going to fight this. And when you get to that point, then you're feeling like the tiger is not a threat to me. I'm in control of my life. And if something happens, all right, I'll deal with it.
Yeah. The tiger's back down to being a kitten.
Good way of putting it.
We talked a little bit about that difference between fear and anxiety. How do you feel like that helps patients to frame what they may be feeling?
Well, fear is a natural response to a real threat. If the tiger's running after you, you better have some fear because otherwise...
Right. It's how we survived all these years.
That's right. The tiger may have its way with you. So that's a normal response, and hopefully that fear will be turned into appropriate action to deal with the tiger coming after you. Anxiety is looking at the tiger who's laying there asleep and figuring that tiger's going to come after me. I know the tiger's going to come after me, when indeed there's no indication that the tiger's going to. In other words, it's an exaggerated fear that doesn't fit with what the facts tell you. And we often see that, of course, with cancer patients.
Right. I spend a lot of time in the office talking about scans are negative or labs are normal. You're now 2-3 years out from this. The likelihood of a cancer recurrence is low, and still have some patients who can't sleep.
They want a guarantee, as we all do. Unfortunately, life doesn't give us guarantees, and especially when insult to our health happens. And so your approach is perfect. That addresses the fear. And then talking a little bit with the patient about what their unrealistic fears are or their anxieties can help them, because as it comes out and they begin talking about it, they often can talk themselves out of it.
Just kind of asking that question, what is it that makes it hard for you to be reassured?
That's right. And what I will say to patients at that juncture is, I'm getting the feeling that as I'm telling you what is likely to happen isn't something that you believe right now, that you're afraid that it's going to be worse. Tell me about that.
That's a great one. We can't have this conversation without talking about what if the scan is positive and the fears that come with that diagnosis of recurrence or even a terminal diagnosis. How do you help patients with that fear?
Well, in that case, the tiger is coming after them, and they need to understand that while we'll bring all the resources necessary to fight that recurrence, they also have to have a chance to process that it may not work. The fact that it's come back, that's not a good sign. And so being straightforward without being overly morose about it is important for the patient to have the facts to the degree they can metabolize them as you're talking to them, and then to listen to them as they describe what this means to them. And it may be that they need some time, tears, maybe that with the family to help the family and help the patient come to grips with the fact that this may be a terminal event. And if it is, let's talk about how to approach that. You still have control over a lot of what's going to happen.
I think control plays a big role
It certainly does.
The diagnosis at that point. Absolutely.
And if it does turn out to be something that we can't reverse, you will have the opportunity to decide how to proceed with this, including how much treatment.
What types of treatment you are willing to say yes or no to.
What side effects you want to avoid.
Exactly.
And what kind of pain control you'd like, if there is going to be pain associated with it. And also, we will do everything we can to help you before it advances to accomplish some of the things that you may have put off, and you realize now, I really want to do this. And it may be time spent with family members or close friends.
Absolutely. And back in episode 2, we talked about how a terminal diagnosis doesn't mean tomorrow, that most patients living with an incurable cancer in this day and age live for years with an incurable cancer. And so there is that concept of living with the tiger, but at the moment, the tiger's not chasing you. You are cohabitating.
Let's put the tiger on a leash.
That's right. That's right. And that's what many of our maintenance medications or immunotherapy medications, a lot of the treatments that we've talked about on this podcast. When you describe the feelings that patients experience at the diagnosis of a cancer recurrence, it almost seems to me to be like the stages of grief, that they are grieving a cancer-free life that now they won't have.
Exactly. And those stages of grief help with a variety of losses throughout life, whether it's losing someone that's close to you, losing a body function, or losing the optimism that you will live forever, which at some point we all hope that will happen.
We all do. Absolutely. So I'll end with the motto from my home state, South Carolina, that I heard today: while I breathe, I hope. And I think that is something that for a lot of our patients helps to cool off those fears.
I agree with you 100%. And the goal that I try to help my patients with is to see this cancer that's returned as a nuisance, not something that's going to control their lives, but something they just have to put up with as they go about doing what they want to. And I think a nice example is Alex Trebek and the way he's approached his cancer. And obviously it has a very guarded prognosis, but he's still doing his television show. He can't do it as often. Sometimes he has to take a break, but he's still doing it.
Absolutely. And that's what we want for our patients, for them to continue to live their lives, maybe not cancer-free, but with cancer. Well, we can't thank you enough for coming into the studio, Dr. Franks. It's been a pleasure chatting with you, and we hope you'll come back soon.
Well, I really enjoyed it. Thanks for inviting me.
Thanks, everyone, for listening to The Cancering Show with JYP, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com, and we can make sure you never miss an episode. We would love to know what you think about the show, or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Till next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.